highlighted by the CDC. They noticed an increase in cases and put Richmond City on their radar. In further conversations with Richmond City Health Department, they had indicated a fairly large proportion of those cases coming from individuals who are Latino Hispanic. And in my conversations with the director at Richmond City, Dr. Danny Avula, I relayed similar sorts of trends that we were seeing. And we basically came to the conclusion that it was a population that overlapped both our health districts. So this would again be kind of the eastern portion of Chesterfield County, the southern portion of Richmond City primarily, and parts of Henrico County. So the CDC team came to look specifically at Latino, Latinx, Hispanic populations. They did a both data dive, so looking at kind of quantitative needs, as well as more qualitative. So that included going into areas such as this one, doing some surveys, household surveys, and kind of determining barriers for access to testing, access to care, so on and so forth. And came up with a number of recommendations that we have been attempting to put into place over time. And those recommendations include having a more concerted communication strategy for individuals in these particular population groups, as well as kind of bringing together other community agencies, healthcare network providers, etc., in sort of a concerted effort to address their needs too. Beyond that, we have been researching ways that individual health departments can more specifically meet the needs of folks that who test positive and therefore are brought to our attention to help them get the resource needs that they might have, especially, and this is one of the big issues, especially if they have to quarantine for 10 days or isolate for up to 10 days, which means not being able to go to work. And a lot of folks in these communities, unfortunately, simply can't afford to do that. They don't have paid leave, for example. And so it's trying to bridge the resource needs that they would have in those circumstances. And we are working through different ways to do that, which include trying to bring on staff to help, again, navigate individuals on an individual basis, literally directing them to existing service provisions, and even researching ways that we can manage funding to improve resources as well.